Hi, I'm Dr. Ashish Contractor and I run the Department of Preventive Cardiology and Cardiac Rehab at the Asian Heart Institute. A heart attack can be a life-changing event. Often people wonder, will they ever be normal again? After a heart attack or a heart bypass surgery or an angioplasty, running a marathon frankly is the last thing on most people's mind. However, each year more than 75 heart patients from the Asian Heart Institute's Cardiac Rehab Department take part in the Standard Chartered Mumbai Marathon in the Dream Run, and this is a picture of them after they've completed their run this year. And about 10 or 12 of them take part in the half marathon as well. In fact, this year for the first time in 2011, we had Jatin Parekh who completed the full marathon. So the question is, how do you go from the ICU bed to the marathon? And the answer is in 3 easy steps. The first is, after you're home and you're initially recovered and you're clinically stable, you need to join a cardiac rehab program for the first 2 or 3 months after your surgery or your heart attack. That will help you get back on your feet in a safe and a secure manner. After that is done, you're ready to take the next step. If you do want to do more, you want to run, you want to take part in marathons, then you need to talk to your cardiologist, talk to your physician, get their go-ahead. There are very few people who have certain heart conditions in which they should not undertake very strenuous activity, but the majority, over 80%, can certainly take part if they want to. Your physician or your cardiologist may suggest certain tests like a stress test or an echo to get a go-ahead. Once you do that, you need to formulate a good training plan. From scratch, if you want to train and run a half marathon, it will take you about 5 to 6 months. And the principle is based on the principle of gradually increasing your distance. So you run an average maybe 3 days a week. 2 days of the week will be a short run, maybe 4 or 5 kilometers. And the third day is your long run. Now the long run, we start with 5 kilometers. And every week or every weekend, we increase that by 1 to 2 kilometers. So it's a very gradual process. You don't overload yourself. In each week, you don't increase your training by more than 10%. How exactly to train, how much you do each week, and a week by week program we'll discuss in a future video that we make. In the meanwhile, the good news today is that if you had heart disease, it does not mean that life is over, and if you so desire, you can certainly take part in a marathon. Good luck.